It's always my people that stop talking last. Yeah. You will be, Jeff. You will be. Now, this is a delightful moment because I get to introduce Jane Lewis, and I don't hardly ever get to do this. Now, Jane very kindly, this is how we roll at CEI. So Isabel Trowler, who was going to be speaking at this time, who's the Chief Social Worker for the United Kingdom, flew from London to Perth, landed in Perth, saw her phone, had a family emergency, had to turn around and fly straight back. And for those of us that travel long ways and are away from our families that far, that is an awful thing to happen and to see, and then to have to get back on that 17-hour flight and try and leg it home. And because Qantas doesn't have Wi-Fi, so seriously. So I tell Jane this and I say nothing for a little bit. And then I give her a little call and say, Jane, how about you fill in for Isabel? And she looked at me, or she said to me on the phone, she said, I sort of knew this was coming. And I was like, excellent then, settled. So Jane Lewis is our managing director in our office in London. She's been with us for 4 years, hasn't she? This is how this happened. So I've known Jane for a very long time. We've been in the same evidence implementation circles for some time. CEI is starting to get some attention in London to, in particular, work with the various What Works centres up there, focusing on implementing evidence and continuous improvement in practice, et cetera, et cetera. And Melbourne's a long way from London. It's a long way. So I was kind of going up and down, and each time I'd go, I'd take Jane out for dinner, secretly hoping if I bought her enough wine, one day she would say yes. And she said yes, finally. When I said, come on back to this not-for-profit kind of evidence intermediary game, come back to it, because she'd gone and tried something else for a while. And she came back, and everyone who knows, oh God, now I hope I don't start crying again. It's just exhausting being me, I tell you. It's just, you guys have no idea how hard it is. Jane is an incredible human being. She has dedicated her entire career to improving the lives of particularly children and families. She is whippet smart. She is so curious. Her sense of humor is, I tell you what, she can take a dig and you suddenly figure out later she already was ahead at digging you, and you're like, oh. She says things like this in meetings. Let's tickle up that proposal and win that. And I'm like, tickle it up. It's creepy, sort of, but let's do it. She's built an incredible team. When she came and started working for us, it was before COVID, and so I was up there and we recruited her, and we got ourselves into a thing called the Evidence Quarter, which is a very cool thing that I wish some of us would get together and do here. A bunch of like-minded organisations working in the same spot in London. Get her a spot there, start to hire some staff. And I said, don't worry, I'll come up every quarter and I'll support you, and it's great, we'll do meetings. And I didn't see her again until our borders opened up. And so all through that time, Jane single-handedly built the UK office into a nice, smart, strong, cohesive team. They have won some incredible projects that will just make such a difference to the lives of folks in the UK and beyond. We also got to work in Serbia together and all sorts of stuff. So Jane is amazing, and you will see how amazing she is in a second. She is going to talk to us all about scaling and how important it is. Up to you.
Thank you so much, Robin. That's so sweet of you. All that wine, I was thinking, when she opens up in the UK, that's going to be me. That's got to be me. I'll kill if I need to. I'd like to start by acknowledging the traditional custodians of the land that we're on today and have been on for this fabulous conference, and to pay my respects to elders past, present, and emerging. It's an absolute pleasure to have this gig. I'm so sorry for Isabel and her family circumstances, and I'm so sorry that you won't have the chance to hear from Isabel as well. She's a fascinating woman and absolutely brilliant, but it's lovely to have this opportunity and to speak at this really brilliant conference. It's been a fantastic couple of days. I wanted to start with a bit of a personal story about my own journey into research on scaling up. I first got into thinking about scaling a few years ago when I was doing a lovely project for an organisation in the UK called the Shine Foundation. And one of their initiatives involved developing teacher-led innovation. And they would fund a certain number of programs for year one, and then they'd select the ones that they felt really had legs, and they'd fund them for 2 or 3 or more years, in, rising up to quite significant levels of funding. And my role was to advise them on which of the innovations that they were initially supporting seemed to have legs because they were in tune with the evidence base, they seemed to be implementable, and they looked to be scalable. So it was a Friday evening. I was getting the train from King's Cross in London up to Newcastle, my Newcastle, not your Newcastle. It's in the northeast of England. I was going to spend the weekend with my sister, and I had a great big pile of papers because I'm kind of a print it off and read it type of person. And I was absolutely engrossed in reading it. I was underlining, I was highlighting, I was writing notes, I was going back and rereading, I was comparing, I was doing more underlining. I was so totally engrossed in it that I missed my stop. I noticed that the train was sort of sliding out of Newcastle, and it didn't stop until Scotland. So that was great, because I had a couple of hours in Scotland waiting for my train to come back, and then another hour and a half of reading time on the way back as well. But Robin, go hard on that timer. You could be doing us all a favour. So I am a little bit giddy and obsessed about scaling, and I do want to share some of that giddiness and obsession with you today. Because the fact of the matter is that, we know that very little actually does get scaled, and we need to be really, really humble about that and accept that if our purpose as evidence and practice and implementation people is to scale, then we're actually failing quite badly at that. Abby Fagan, writing in the States, says scaling up evidence-based interventions to have maximum impact at the population level remains one of the most vexing challenges facing prevention science. EBIs represent only a fraction of the programs delivered and the policies enacted by public service systems. And many, many studies show across all sorts of service areas that most people who even actually manage to get to services don't end up getting services that are evidence-informed. In the UK, Colin Waterman was involved in a huge central government initiative. Hundreds of millions of pounds were spent on it to support evidence-based programmes, including treatment foster care, Oregon, to support local authorities, municipalities in England to implement them. And the treatment foster care Oregon is an evidence-based program. It was really carefully selected. It fitted really well with the needs in different areas. There was a national implementation service that was set up of brilliantly committed and really skilled people to support local authorities in implementing and sustaining programs. And following that 15-year government-driven nationwide implementation initiative, only one UK treatment foster care Oregon site remained in 2020. And Harry Scarborough and Yanis Kairatsis, writing from an information systems and organisational theory perspective, say this slow and uneven spread of innovations not only means that patients are deprived of clinical benefits, but also potentially increases inequality in health outcomes by limiting state-of-the-art healthcare to the wealthier members of society. And that point about increasing inequality, not just failing to address inequality, actively increasing inequality. I don't think many of us get out of bed and come to work to do that. I think most of us are here doing our work because we really hate inequality. And the idea that failing to scale means increasing inequality, I think, is a really tough message. So, folks, we've really got work to do. But having said that, not everything should be scaled, even if it's shown to work and to work well. So John McLean and John Gargani use this phrase, judicious scaling, and they make the point that scaling is a choice, and it's a choice that needs to be justified. And they and John List, Andrew just speaking earlier referred to John List, his book is absolutely fantastic. Together they make the point that scaling involves opportunity costs. If you're scaling a program or an intervention or something, you're taking time away from something, you're taking resources away from other things, you're taking attention away from other things. And, you know, we know that our service systems, and actually more important, our service users, are dealing with a hell of a lot of stuff, and they actually have limited capacity and limited resources to engage with something new. So I think that's a really important message, that we need to think and we need to make active, judicious choices about what we do and don't scale. There are also inevitably tensions and trade-offs between reach and quality and cost. So you probably just can't have low cost, high quality, high impact scaling that reaches significant numbers of people and that particularly reaches the most marginalized people. You can scale with quality and reach large numbers of people, particularly large numbers, particularly the most marginalized people, but you probably can't do that without it costing you something. So we do need to be really thoughtful about what we scale and why we scale it, as well as about how we scale it. Trisha Greenhalgh, who, you know, many of us slightly hero worship, and Chrysanthi Papuzzi have made the point that there are diverse theories and diverse perspectives on scaling up. And they've done this really nice paper where they compare the way in which scaling is conceived and constructed in different sciences. So they make the point that in implementation science, scaling is a structured and phased approach that's based on multi-site replication. I mean, they acknowledge that more recently, the implementation science world has become more adaptive. You know, we're thinking more flexibly, we're recognizing the importance of responding to local context. But still, I think that as a kind of characterization of implementation science is probably not massively unfamiliar to many of us in the room. And then they compare that with complexity science, where scaling is an adaptive process of change that requires attention to the ecology of dynamic systems, and where things like acknowledging unpredictability, recognizing the kind of self-organizing power of systems, and harnessing conflict constructively and productively will be important features of the way in which scaling might happen. And then they compare that with social sciences, where the focus is on the social and organizational forces that shape individual actions and individual decisions and choices, and where identities and feelings and expectations and routines and norms and so on, at both individual and organizational levels, will all be important influences on adoption and enactment. And that's not to say that you can't combine these different perspectives. We can, and we probably should. We need to do it Bianca style and not bish bash bosh style. So we need to do it thoughtfully and carefully. But it's also about being aware which of these lenses we are bringing to bear on scaling at any particular point, and really understanding how that lens shapes and distorts what it is that we see and how we make sense of it. And I think also recognizing that that structured and phased approach that's based on focusing on innovations and sites probably won't cut it for implementation science anymore. So as well as different perspectives on scaling, there are also different options for scaling. And Anna Williamson and I just absolutely love this slide. So Anna showed this slide earlier in her talk with Cara on the work that we're doing with Movember. But it recognizes that there are a range of different options for the way in which we might scale. You know, direct delivery, where one organization does all the delivery nationwide or bigger than nationwide. Not all that many organisations are really equipped to do that. I think, you know, what we've heard from Nick yesterday and from other people doesn't particularly suggest that academia is going to be embracing the opportunities to be doing this very hard. Many not-for-profits that develop programmes really well don't necessarily have the capacity to scale them either. Then there's that kind of centrally managed replication, probably what we're most familiar with in implementation science, where something's delivered, managed by one organisation that enables other organisations to deliver it through licensing arrangements, franchises, train the trainer, quality assurance support, and so on. There's also commercial or non-commercial adoption, where we just pass the IP on to another organisation and get them to scale something. I skipped over partnerships. That's a really important one, where a lead organisation partners with other organisations and they jointly take responsibility for scaling and for delivery. Commercial and non-commercial adoption, government adoption, where the innovation just becomes the way we teach literacy in this country, or the way we treat depression, or the way we rehabilitate offenders. I mean, we know that political alignment is a really important part of scaling, but there are not very many governments that are prepared to really take on responsibility for scaling and doing the delivery in that kind of way. And then there's open source delivery, where an innovation is put on a website with some resources and guidance documents and so on, and just made available without any kind of constraints to anybody to use it. And the amount of control that the central developer has varies from the left-hand side of the spectrum, where it's all about central control, to the right-hand side, where really there's a complete loss of control with sharing of control in the middle. And the point is that any of these might be right for any particular innovation. Which one's right will depend on things like how complex the intervention is, how familiar it is, how consistent it is with stuff that's already going on, the capacity of the delivery of the originating organisation, the capacity of other organisations to take it on. But the point is that you kind of need to know which of these you're actually aiming for. And we're really surprised often in the work that we do with programme developers and with organisations helping them to scale, by how many of them really just haven't thought about this. You know, they have a notion that they want to grow, but they just haven't really kind of thought about what sort of form that growth might take. So that's a really important part of a scale-up strategy. And, you know, there are a number of elements to it. You know, there's getting the innovation right. So an innovation that's usable, that's not too complex, that's adaptable, that's flexible, that's acceptable, and that's got all the different bits and pieces in place. So it's got its theory of change in place. It's got its quality assurance mechanism in place. And then there's having the evidence that would justify and support scale up. I mean, you know, we've heard in several presentations that evidence isn't a prerequisite for scaling. I think it probably is for those of us in this room, but the point is that, you know, lots of stuff gets scaled up without evidence needing to be there. But for us, our mission is very much about making sure it is there. And that might be evidence about the need, about the effectiveness, about the implementation requirements and strategies, and about the costs. Now, I don't think that innovating and I don't think that evidence are very easy things to do. There's a lot of very bright people in this room dedicated to doing those, and I think the work that we're doing is hard. But I think those are actually the easy bits of scaling. Those are the bits that we can most easily control. Those are the bits that we invest in most, and those are, in the end, the easiest bits. What gets harder is doing the assessment of scalability, and of the readiness of the programme and of organisations in the surrounding system to scale, and not just doing the assessment, but doing something as a result of the assessment. So the assessment isn't a binary yes, no, green light, red light. It's an indication of the work that we need to do. And that then leads to the fostering of organisational readiness and building the capacity, the culture, the partnerships, the relationships, the processes within organisations to absorb something and to deliver it well, and doing that work at scale. And then developing and mobilising the whole wider system, the whole world of policy and regulation, legislation and funding, and the kind of social norms and social movements and social pressures for scale. And I think the work gets harder the further down that those elements you move, which perhaps explains why so much of our work is just stuck in the top two without nearly enough attention being paid to the ones below. So, you know, that is a really important point, that we do need to involve that whole service system right from the start. We need to be involving consumers and service users, practitioners, service organisations, support agencies, peak bodies, funders, policymakers, and we need to be getting them involved right from the start and taking them on that journey with us. And Harriet Courts, whose work on scaling I massively admire, she's had to leave early, so she's not here now, but you know, one of the really important points that she and her colleagues have made in their work is that political alignment is a really key driver of scaling, and I think in many of our countries we would see that in what has scaled and what hasn't scaled. So really engaging with that wider system is absolutely essential. Scaling also requires more attention to be paid to markets and to distribution. So the first question that we need to be asking is, who is the doer at scale and who is the payer at scale? Those are absolutely fundamental questions. And again, I'm really surprised by how often they don't get asked. We really need to know those things, and we need to engage the doers and the payers right from the start. But we also need a much better understanding of demand. We need to know much more about how much are people willing to pay for this intervention. We need to know about its market viability. We need to know about what market forces are going to support the intervention at scale and which ones are going to challenge it. And we also need to know much more about how we're actually going to distribute things at scale. And again, I'm often surprised in the work we do by how much this is a stumbling block to scaling. But Matthew Kreuter and Jay Bernhardt have done a terrific paper where they compare the car market with the human services system. And so if you think about the car market, there's consumer magazines that encourage everybody that wants to, all the petrol heads out there, to expect the newest and the fastest and the shiniest car and to get ready for it. There are extravagant car launches, so you couldn't possibly miss, if you're in this space, you couldn't possibly miss the launch of the new model. There are slick Jims and slick Janes whose job is to advise us on why this one is so much better than the car that we've got at the moment and why we really must buy it. There are incentives baked into the system that encourage them to distribute more of the cars, to sell more of them. Naturally, Slick Jim and Slick Jane aren't affected by those incentives at all. They give us unbiased advice. There are loads of choices that we can make about the model of car: 2 doors, 4 doors, soft roof, hard roof, fluffy dices, musical horn, whatever we want. There's financing arrangements available. Yay, I've got a high interest loan for a depreciating asset. Brilliant. Good on you, girl. You drive away with an owner's manual, and there's a whole system in place to keep us on the road and to keep the innovation going. And the point that they make is that in human service systems, most of that infrastructure just doesn't exist, or where it exists, it's not brought together and it's not leveraged and used in support of scaling. So they make the point that marketing and distribution efforts are unassigned, underemphasized and underfunded. We've got bits of it, but we need to find ways to bring it all together and to leverage it in support of scale. And last slide. I just wanted to sort of suggest some directions for research and practice building on this. So I do think that we really need to get to grips with this, and we need to do a better job on it. And I think that that is going to mean doing science and doing partnering in some somewhat different ways. So I think we need to develop and test interventions with scaling in mind right from the start. We need funders to be asking about what people see their end game as being, just to get the thinking going. We need to be testing models that adopt that end game. If it's going to be a train-the-trainer model, if it's going to involve working with partners, develop it that way and test it that way right from the beginning. Don't do that later on. We need to bake fidelity monitoring and quality assurance into the programme, not take it away when the trial ends. And we need to use trial designs like smart designs that help us to really understand how low can we go, how can we develop implementation strategies that are scalable. We need to assess and understand and cultivate demand, and we can't do that on our own. We have to work with people who understand entrepreneurship, who understand financial and business modelling, who understand markets and marketing, who understand commercialisation and communication, who understand management and organisational change. We need to think about how we can build consumer demand, how we can develop that evidence-informed citizenry that holds government and the public service system to account that Vivian Singh was talking about yesterday. We need to get people to expect effective interventions. And we need to build that infrastructure. We need to work out what we need, where it exists, how to leverage it, and how to build in what doesn't exist. We need that whole systems approach. And we need to lean into and work with the political and social and service system and understand how to do that well. And we need to do this with an absolutely central consideration being equity. It's pretty gut-wrenching to think that our work might end up increasing inequality. So I think that's a really exciting agenda. I think we have to land this stuff if evidence and implementation are going to fulfill their potential. I'm a positive kind of person. I actually don't have a pair of grumpy pants. So I think that we can do this. And I think if we can get this right, then we can create really significant social change and improve services at scale, especially for the people who need them most. So let's all jump on the scaling express, heading for Newcastle. Let's all override our stops. Let's keep going to Scotland. Let's go beyond Scotland. And let's take evidence to the next level. Let's scale it with impact and with equity. Thank you.
Okay, we've got time probably for Bianca. Just one question that's not Bianca. One. Otherwise, Bianca gets it. Oh, right, fine. You're new. Say who you are and how did you get here?
Thank you. Thank you. My name is Jules Alejandre. I'm, by the way, from Scotland. I hope you enjoy your time there. My question, I'm from Glasgow. My question is, in the UK, both local and national governments have an obsession of investing a lot to many pilot interventions and paying less attention to scaling up. How do we encourage governments to shift the focus to scaling up interventions that work?
It's so important, isn't it? And it's not just central governments and local governments. It's also universities and it's funders of research and innovation. It's so much easier to get funding for the development of an intervention and for the piloting and evaluation of it than it is to get funding for scaling it or for testing it at scale. So I think, I don't know what the answer is, Julian. I think we just have to keep banging on about it, really. You know, I think we have to keep saying, so what do you think the end game for this intervention is going to be? Okay, well, can we start testing that end game right from the beginning? What is your ambition about scale? How do you think that's going to happen? Okay, can we start building those partnerships and building those relationships from the very start? So I think the onus is probably on us to ask those questions and, you know, to be prepared to push back against funding or against initiatives that are just going to develop an intervention that doesn't really have any chance of scaling, and to really make the case for doing it well.
Can you go back to your slides with the key takeaways?
I think I can.
Yeah.
Didn't you like my train one?
Mm-hmm.
Can I just go back to the train one again?
No, the one before. And I still have my grumpy pants on, just so you know. And in that way, we've always been a good couple, the two of you and me. But I was just, when you presented these points, I thought, we've had this, haven't we? I mean, with the branded programs, don't we have what you're asking for? And if that is what you're asking for, I'm like, I'm not sure if we really need that. And I'm a bit provocative. I know your stance on this. Yeah. But as you know, Robin, I love Jane, but I just wanted to put it out there because there's something up in that message which made me feel slightly uncomfortable because we've had some tests in this area.
If we had what we need with the branded programs, we wouldn't have fallen to only one treatment foster care Oregon site. You know, I think I think we don't have it in a way that's scalable and sustainable always with programs. You know, some of this is baked in, but it's baked in with sort of conditions and requirements that just end up not making innovation scalable. I think we've got a huge amount to learn from the branded programs, definitely, absolutely. You know, they do what they do really, really well, and that's why they're so effective. But I think we need to learn how to kind of leverage those approaches and incorporate them with other sorts of interventions in ways that really do make things scalable. And, you know, that does involve engaging, you know, the wider political and social context and infrastructure as well. And I think that that's something that we're leaning into and we're learning about. You know, there'll be people in the room here who are absolutely brilliant at it. But I think that's a kind of body of practice and knowledge that we need to enrich and develop and share.
Okay, Nick gets the last one, and then we'll go to the panel.
Jane, thank you. This was brilliant. So Nick of Dallas National University of Singapore. This was absolutely brilliant. It's such a nice summary. The one thing that's just made me think that we haven't really covered in this conference, and we typically do not cover in these conferences, is what the Global South is basically to say, to add, and to contribute to the Global North when it comes to the sort of the points that you've got on this slide and your entire sort of presentation. I think we've pretty much, myself included and a lot of colleagues, we've ignored a lot of that. And when you go and talk to people who work definitely in health, in global health, and the people who do the work in places where the resources, if we think that the resources we have are limited, then sort of wait and see what happens there. I think they've done some phenomenal work and some really good examples of successful scale up. They're not very many, but there's a lot of failures and successes that we can bring into this conversation. I think as a community, looking at who's here, the fact that we've got 36 countries this meeting, maybe we need to start intentionally thinking about these meetings and bringing in colleagues who are doing this work elsewhere. We've covered a lot of really, really cool global work here, but there's so much more that perhaps we can facilitate, hear a bit more about, because every time that I feel very inspired every time we hear about some of those stories, many of which do not make the academic literature, unfortunately, or any literature for that matter, in a language that most of us may be familiar with. So it's just an observation that perhaps we might, in terms of program committee for upcoming EIS meetings, we might want to think about that collectively. But thanks very much for a lovely talk.
We're going straight into the final panel, so just hang, let me hug you.